I'm Paolo Narciso. I'm here to moderate this incredible panel. And I am not going to tell jokes, but we are here to talk about a really important question. Does AI hold the key to sustainable social care? That's a question we're here to explore this particular afternoon with this particular panel. Artificial intelligence, as we know, is growing at such a rapid rate, and the adoption is very rapid. Just for context, it took 75 years for the telephone to have 100,000 customers. It took the internet about 7 years to be able to do that, and it's taken ChatGPT 2 months. And that's only ChatGPT. We're not talking about all the other products that are out there that's from an AI perspective. So AI is obviously rapidly being adopted, and it's also, despite the fact it's also rapid, can also be disruptive to the way we work, the way we play, and obviously the way we live. But I'm not here, and we're not here to talk about AI in general. We're here to talk about something that's a bit more pressing and a bit more human. It's how AI can actually be a part of how we care for each other as human beings. And so with that, I have, fortunately, three very distinguished panelists who will explore that question with us. Theo Lau, I've known Theo for quite a long time, despite the fact she doesn't really want me to tell people that. Theo Lau is a well-received author. She's published 3 books. Her latest book, which is called Banking on Artificial Intelligence. I was walking around, I was in London on Sunday, and I was walking around the bookstores, and there was her book, like in one of the big displays. So that's pretty amazing for me. I walked in there and said, I told them I knew the author, but I didn't get any special service for that. But she's also written 2 other books, one on the metaverse and the other one was called Beyond Good, which she co-authored. She's also the host of a widely listened to podcast called the One Vision Podcast. What she does is explore the intersection of technology and social good in general, and explore how technology might be able to do that. Next, we have John Maynard. John, we just met just last night, so you can't say bad things about me. But John has been a very, very unique perspective. He's been 30 years working on the intersection of data as well as AI and ethics. And he is experienced as a social worker and as a caregiver, which gives us a completely unique perspective. And he leads his group at the SAS Global Institute in Raleigh, although he's rarely in Raleigh these particular days. And then last, and not the least of our speakers is Pete. Pete is a physician. He leads Google Health and looking specifically at scaling AI, specifically in terms of clinical practice. And he'll be able to give us a tremendous perspective on the use of AI from a clinical perspective, and also apply that as we look at social care. I've asked each one of them to tell us something unique about them, so I'll tell it. Theo reads books from the back cover to the front cover. Not that unique when it comes to other countries, but for us here in the US, it's quite unique to do. John, aside from the fact that he is an Ohio State fan, so please do not boo for him, especially if he went to Michigan. We like him anyway. But John meditates quite a bit. And Pete, aside from being a college rugby player, also practices quite a bit of yoga. So we can ask them questions that have nothing to do with AI if we want to, around those particular subjects. But let's start off with the first question, and if it's okay, Theo, I'll ask the question to you first, specifically on the issue of AI and your expertise around ethics. We often talk about digital transformation. We talk about the use of AI. How do we ensure that older adults or people who are in vulnerable communities, especially those who don't have tech access, aren't left behind? And how do we ethically deploy AI to these communities?
That's a big question, Paolo. Thank you so much for having me. It is an interesting topic and a very important one, not just for social care, healthcare, but also for the industry that I'm in, which is financial services. One of the things that, of all the things Nima talked about this morning, which absolutely resonated, he talked about how do we scale social care with technology. And it's the same way we think about financial services. How do we scale access to financial services to more people? And I think the short answer I would give to that is outcomes. Look at outcomes. Are you measuring what is important? What are we measuring? So, for example, if we think back about fintech a decade ago, we look at, fintech are the good guys. We have the good ethos. We're here to disrupt financial services. We are here to provide things to people who otherwise don't have access to. And what do we measure? People get very excited when they say, oh, I can actually open an account with 10 clicks. I can open a bank account in less than a minute. And they get so excited with it. People say, yes, perfect, this is awesome, this is what we need to do. But if we take a pause and think about it, so what? Great, wonderful, yay, I can open a bank account faster. But what consumers need, what members need, are not a faster account opening. They need access to service that help them. Small business owners, they need access to credit. An immigrant need access to banking services that, for example, it doesn't cost them $20 to transfer $90 to Africa, right? That's what they need. They don't need faster account opening. They need access to services that help them. And so it's the same way with when we think about social care, when we think about putting all these technology in there, is it getting them to what they need? What are we measuring, right? And I think back to, for example, my journey back when we were working together. We did an ethnographic study in Tennessee, and we had over 100 people in there, and this is something you would definitely appreciate. There were two groups of people we were working with, a group that are 60-some-year-old and a group that are 80-some-year-old. Now, this was the younger self. I'm over half a century old, for those who are curious. So the younger me was like, yes, we can totally use technology and to do what we need to do. Come on, this is what we do, right? We'll go announce a 60-something-year-old who unfortunately is still working. What do you need? What tech can we put in your parents' place so that you feel safe when you walk out the house to work? And then we turn around and ask the 80-something-year-old, what technology do you want to have in the house when you're alone by yourself? Now, thinking back 10 years later, I'm like, oh my God, that is such a stupid question. But for those, many of us, and still nowadays, who are in tech innovation, we think technology can solve everything. And you know what ended up happening? The 60-something-year-old, they looked at us, they're like, we don't want technology. We are working, and we are worried every minute we leave the door because we don't have financial security. We don't have money. That's why we're still working. If you want something to help us, I want financial security so I don't have to work, so I don't have to multitask, take care of my kids, take care of my parents, and having to go to work. It's the same thing with 80-something-year-old. They're like, I don't want something that monitors me, it invades my privacy. I don't want something that tracks where I am. I want my daughter here with me, right? And so it brings out the human side of things we don't always think about. It's beyond responsibility, it's beyond ethics, it's just human.
And what have you seen, what signals have you seen that we're moving in the right direction, or maybe that we're not moving in the right direction?
Depends on the day you ask me. If I spent another day back home, which is in Washington, D.C., I'll give you a very different answer today. There's hope. There's hope. I am seeing more people focusing on community level efforts. So in the last three months, ever since January 20th, I'm not going to bore you with the details. I've been more intentional in going out and reaching out to people, asking, what are you doing in your community? So I reach out to a wonderful friend of mine in Charlotte, where he's actively using AI to help his credit union modernize. he find different ways to do data orchestration so that they don't have to spend millions and millions of dollars where we feel AI is far-fetched, and it's not. You see companies like, Blooming Health, right, that are trying to use technology to automate the mundane processes so people can get access to the care that they need anytime, anywhere that they want. Same thing within banking. We see startups working with community banks, implementing chatbots so that small business owners can reach out to the chatbot, which is interesting. Sarah, that's the name of one of the bots, that they can get the loan files ready so by Monday, when the banker comes in, they already have the loan approved, right? So these are promises of technology that help to create efficiency is a very bad word, but looking at reimagining how you get from A to B so that people can get the help that they need.
Great. Pete, I'm going to go to you, and I'm going to skip John only because I'm going to give him a hard time for being an Ohio State fan. And I didn't give you a long introduction on purpose because I think the audience would love to hear more about Google Health and what you're doing. But specifically, you've seen it firsthand and what it takes to scale AI across healthcare systems. So I'd love to hear your vantage point about how the public-private sectors might be able to partner together, and what role do they play in building sustainable infrastructure, specifically for social care.
First of all, thank you. It's wonderful to be here and to hear from all of the speakers today. I really bring two lenses to the discussion and to my work. The first is as a clinician. I'm a pulmonary and critical care doc. That was really, I like to say, the only job I was ever trained to do. And that's really what I spent 20 years doing. And so critical care and the ICU is a very specific lens and a very on sort of care that often involves vulnerable or aging populations. And what I saw and cared for in the ICU was a reflection of sort of the downstream accumulation. It was sort of the end terminus of a lot of upstream challenges and failures, some of which were technical, many of which were about access to care, many of which were about access to information. And access to information was a challenge for people, for patients, for providers. And so that sort of through line was part of my experience of being an ICU doctor. And sort of as a result of my interest in this sort of intersection of data and technology with how health information, which is really complicated, really messy, highly fractionated. We have all these digital crumbs that we sort of leave all over the place. And beginning in about 2018, I started doing research with research teams at Google to sort of figure out how can you bring all those crumbs together. How can you use those data elements in a safe and secure way to kind of understand disease progression, but also to do search and summarization, to take this huge and growing volume of really complicated health data and make it useful sort of right at the point of care. That theme sort of continued. I continued to basically have a day job that was as an ICU doctor up to and including the first year of the pandemic. That really brought into very sharp focus the limitations of our tools, technology tools, information sharing tools, a lot of the things that we depended on, including lots of social networks and supports, were removed in that setting. And so it sort of laid bare the inefficiencies and really the insufficiencies of information tools for providers. And so that theme really tied in well with Karen DeSalvo, who is the Chief Health Officer at Google. Side note, she just announced today her retirement. But Karen really was, had many insights, but one of them was that health wasn't healthcare, and it wasn't sick care, and it wasn't what I was doing in the ICU. Health was on a continuum of wellness and life experiences, and that Google was really uniquely positioned to help people and their informational needs on that health journey. And sometimes, and the work I do is for providers particularly, but really, I think if I was channeling what Karen would say, information is a social determinant of health. Really one of the things that she felt most strongly about and that we've been most focused on as a company is when people come with their health journey and informational need to search or to YouTube, that we have clinicians like me who kind of work to make sure that information that gets surfaced is handled in a way that's authoritative, regionally appropriate, sort of specific to the question. And so then to sort of AI, and I think that Theo made a number of points that I'd really like to brightlight. We're at a time when there's an explosion in information tools, and some of them are what we would call generative AI, and some we might call machine learning. And I would flatten a lot of that complexity and sort of label all of those as tools. And they're useful in the same way that any tool is. They're very powerful, but they're useful when they're linked to an unmet human informational need and tied into a workflow and measured at the person level, right? And we can talk a lot about measurement and how to make tools and assess tools, but really value is measured. You say it's like the truth is at the bedside, right? And I think that's one of the ways to conceive of it is don't get hung up on who makes the technology or even what it can do today, because it'll do different things in the future, but think of it as a really powerful toolkit. And it's best applied when we're really explicit about the informational problem to be solved, and we engage the people who are really directly affected. And I guess the other theme that we've seen is the democratization of access to these tools. And I think that that's a really important theme that we might want to sort of circle back to. But that's another thing that's changing. As the tools become powerful, they also become more composable and more usable by folks for their everyday lives and for work and to make those connections. So that.
And Pete, from your vantage point, and you've seen AI implementations from a healthcare perspective, what is a lesson that we can learn, particularly as a social care organization, a CBO, that might be applicable in terms of being able to scale AI down to the community level?
So one thing that I think is a general way of approaching these technological tools is to think about a couple of things that are very unique as you get, not to just healthcare like the sharp point of the ICU bed, but information flow and care across that whole continuum is that it's important to really sort of think about that problem to be solved, and so I think that's really where to begin rather than what tools will be used.
Great. And John, not the least, but from both your public policy work and then also your personal experience, you've been a caregiver as well as a social worker, and you've audited a lot of social programs as an accountant as well. So you've seen the challenges of navigating social care system really from all angles. Where do you see the biggest opportunities for AI to simplify the access to public benefits and to also obviously be able to support caregivers and reduce the burden for community-based providers?
I thank you for having me here in the first place. I think the answer to your question, we heard it from the very first speaker that we heard from today, which was President Bill Clinton, because he said connect and empower. And I think that's on the patient member side, but it's also on the human side the other way in terms of both caregivers and government folks. So I used to work, and I used to teach people how to manage one of those COBOL eligibility systems that they're talking about. And at the time, it was the greatest thing ever, and I hated it for a lot of reasons. But workers who were in that space, when I started on day one, I had 600 households that I was running. And they say I'm doing social work, but I really wasn't doing social work because I didn't have time to talk to the people and really figure out what was going on with them and what they needed. If I learned something, I filled out a piece of paper and I sent it upstairs, and hopefully somebody in social services, and there wasn't that many somebodies up there, were going to follow up with them and they would get what they need. So I think I was never convinced that that was happening, and that was a problem for me. And then from the policy standpoint of my time in government, we've heard a lot of discussion about waivers. Waivers means that you have a level of care, for a lot of them, where you would normally be in a nursing home. You need a skilled nursing. But a lot of the waivers means we're not gonna keep you institutionalized. We want to bring you back in the community where you want to be, because we know things are better for people there in the community. One of the things that we sign off on is that patients are as safe in the community as they would be in a skilled nursing facility. And I used to sign those things when that was part of my job, because it's part of the risk management process, and I felt good about it. And then I became a caregiver for my father. And so I understood Medicare. I had spent years in Medicaid. I was pre-med, I didn't make it through, which is why I become CPA. CPAs are just people who wanted to go to medical school and couldn't make it. But ultimately, I mean, I knew a lot about the healthcare system and I knew a lot about those services, but when I was a caseworker, I didn't know what community organizations were out there and what services that they offered, which is why I had to do the referral. As I was on the job, I sort of learned. My problem with my father was I got a real education in what I didn't know. So he was tied to two major health systems in the Columbus area, one that was handling his pulmonary problems and his diabetes, and the other one was Ohio State was handling his cancer stuff, which he beat. But I'm trying to navigate two systems. That was very difficult for me. He lived 2 counties away. I didn't know what services were available where he lived. It was a nightmare for me, and I knew about the areas on aging, and I knew places to go, but I still had a job to do. And so I was trying to navigate that on my own. It wasn't very good. He was also, I'm gonna say it, he went to the VA, and I didn't know anything about the VA. I wouldn't say nothing, but I knew very little. I know what happens if you're a veteran and you show up in a long-term care facility, what's gonna happen to your money. That's what I knew, because I did eligibility in that space. But how he was accessing services and what they were covering, I didn't know. So I think that is the rub, is it was completely disconnected. All of the programs that we manage in government are disconnected, and partly because that's how they're funded. And I heard somebody use the term braided funding today, which is a very, very good thing, also very tricky to do, to put together, because I'm a compliance guy. There's a lot of rules about what you can and can't do with government money. So I think that's the problem. I'm looking at something like what we're talking about today with Blooming Health and these kinds of platforms to really be able to help me connect the dots and to help me make sure that things are happening so that I can get those references, I can get those referrals, and I know that they're happening. And I say that is important because when I was signing off in those waivers saying patients are good, after my experience with my father, I had a much different feeling as I signed those forms and saying patients are safe. And so what I would say is before I felt secure, and after I felt like what my mom used to say when she combed my hair when I was 7 or 8 getting ready for school, she'd say, we'll just give it a wish, lick, and a promise, right? And I felt like that's what I was doing when I was signing. I had hope, but I didn't have the data, and I didn't have a good feeling.
I just wanted to link to that last piece with this sort of concept that I think you hear on the clinician side and lots of places, which is sort of trust but verify. And I think relatedly, sort of care moves at the speed of trust. And so sort of one of the ways to think about tools, including AI tools, are sort of tools to help encourage that kind of trust, as opposed to I put it on a form somewhere and I hoped that it landed in front of maybe the right person. So, and again, the technology is an enabler of some of that, but that's a human informational challenge and need. And I think that trust piece is often a challenge too.
Yeah, I agree.
So we talk about trust and we talk about the use of these particular tools, and the tools are often having to use not just from the person who needs care, but also obviously from the social worker's perspective. And this is a question for the entire panel. How do we overcome that, right? How do we overcome sometimes the distrust in the use of AI tools, and also from the social worker's perspective, Does this thing eventually replace me, right? And that particular concern. Yeah, absolutely.
So first, I don't think you should replace the social workers. So I work at a tech company that's been doing AI for 49 years, and I am not a data scientist. I could code, I don't even really code. I'm a business person. And so I think the answer there is, keeping the human in the loop. But there's a lot of activity that we carried out throughout the day in government and in these programs, which many of you also do, that are administrative tasks. And there's where I see the AI agents and these things sort of taking on the burden of doing those things. I think a human should make the decision about eligibility at the end. I don't think a machine should. And a person needs to be there to communicate and interact. So that's how I think you get to trust, and that's how you get to the relationships. I've heard that word a lot today, is through processes like that.
Yeah, and I think that idea of enabling and sort of using technology to upskill and take away some of the work that's sort of high cognitive load, like it takes a lot of attention, but it's actually sort of low value in terms of what the human brings. Clinicians, physicians, providers of all type also feel sort of a threat to professional identity, and so I think that's a theme that comes up. But I actually think one of the ways that I've started to sort of recast that a little bit is to sort of think, if I didn't have a certain amount of moving data type drudgery and I had to look at the screen all the time, like what would I do with my eyes? Like maybe look more at the person in front of me. So I think those things that are extremely human, those are those experiences you'd really like ideally to see enabled through technology taking care of the not so fun stuff.
Yeah, in Ohio, I helped implement the Primary Care Plus program for value-based payments. And I told my own primary care physician I was working on that. And what he told me was it takes 142 clicks to get through the EHR system. And if I say yes to something or need something, there's more clicks. And he apologizes to me before we begin that he's going to stare at the screen. Don't take it personally.
That hurts. But what you said earlier reminds me of something that Nima said this morning. He says social care is not about processes, it's not about paper, it's about human, it's about people, right? So if we recast that, looking back at, for example, one silo of social care and financial services that I look at is caregiving, right? The area of caregiving. How can adult children help their parents navigate through all these, like the experience you went through? And one of the overwhelming things I keep hearing from people is they don't even know where to start, right? How do I know what my parents can and cannot have? How do I know where they can apply for certain benefits? How do I know if they're eligible for X, Y, and Z? And I think this is the place where technology and AI, if you will, if I may, be able to go through all of these different segregated systems and platforms and understand you as a person in the area that you're in, based on the financial situation that you're in, based on who you are, where you live, et cetera, and help you navigate through all those. Imagine the time that you can save, right? I don't have to worry about calling and figuring out someone picking up the phone.
We don't answer phones in government,
Yeah,
especially in
exactly.
COVID. They taught the people no one answers phones.
Yeah, or clicks, right? Here's another 149 clicks. I think this is where you can keep the human, keep focusing on the outcome. Again, going back to what are you trying to do is outcome-based. Let's focus on that.
And Theo, one of the things you talked about in our first question, and you gave the example of the work that you did in Tennessee. And as we look at AI, we see gaps, right? Obviously, and we see gaps in usability, we see gaps in how it's designed. And one of the areas that we see is the lack of tech access, right? It's actually something that you write about quite a bit. How do we ensure that people aren't left behind, particularly the people that we serve?
Tough question. I would take it as twofold. One is having access to equipment, to infrastructure, and the knowledge and the understanding, the skill set to navigate it. That's one. The flip side of that is for AI to be able to serve a diverse population, it also needs access to different cultures and languages and all of that, right? So the second part is way easier to answer in a sense, and I'll give you a stat. There are over 7,140-ish living languages being spoken in the world today. Okay, that's like a lot, over 7,100-ish. If you look at Hugging Face open source, there's 80 languages being supported in there. So now we talk about United States of America being a melting pot, tossed salad, however, whatever way you wanna describe it. We have lots of cultures, lots of people from different backgrounds that live here, that they need access to care. If we are going to implement these tools in communities, we need that to serve people. We can't have something in there that just serve people who speak Western-based languages. And that was a problem that we saw in financial services, is a lot of these tools, it work with the majority of the cases, but what about the rest, right? And so that's where I think we need to find ways to overcome it. We see governments, we see nonprofits taking up the time to train these models to serve more people. So that's one answer. I think the other one, which is promising, is I see more institutions taking up the train-the-trainer approach, right? So getting people who understand the technology, train the people that work in their communities, and have them train the rest of the people. Community-based services is where you can instill the trust, because that's where people know and understand them, not a stranger to walk into a house and say, here, click this. That's not gonna work.
I'm going to ask the kind of what I call the magic question, right? And I'm going to ask it for all three of you. So if you had all the funding and you had the support and you had it tomorrow, right? What is the one AI-powered solution you'd want to see deployed to improve social care? Aside from obviously deploying Blooming Health's new AI agent.
I think, and it maybe gets back to the point that I was making earlier, is that what I would hope for is that AI, in a way that we do that's measured, and in a way that we, to the best of our abilities, kind of ensure that it's being used responsibly and reliably, allows humans to focus on things that are now exclusively human, to turn away from a screen, and to sort of disintermediate technology from much more human sorts of connections. So I think that's one piece. I also want to speak a little bit to the question that Theo addressed in terms of this digital divide. Most of the world doesn't have a laptop. Most of the world doesn't have an iPhone. And so when we think about tools, open source tools, tools for builders, empowering folks as some of the barriers to entry to make tools that are very regionally specific. Translation is a good example where tools get better and better to sort of help with certain sorts of, visual or spoken translation tasks. Like, those are really good use cases for this powerful technology. But I think it makes, it's really critical to sort of match that, and that in some cases, it's the human being who's then taking those AI insights to people who will never have a cell phone or touch a computer or do anything that relates to what all of us sort of nominally think of as, kind of normal tech.
Good question. Yeah, that's a toughie. And I think I heard a lot today about people struggling to get to adoption and struggling to reach populations. And I think the answer to that is somewhat what my boss told me my first day doing social work and eligibility. Deal with people where they're at and not where you want them to be. And I think that we build structures and we force people into those structures, and that's not necessarily the answer. So I've been thinking about this a lot since I knew it was coming here, and I've been thinking about agentic AI and how you keep a human in the loop. But I had written something I don't know, 6 months or so ago. And it was really, because I talk to people, not just in the United States, I do some global work. So I talk to foreign countries about how they're delivering social services. And one of the things I think we need is multi-channel, right? So deal with people where they're at. There's not just one way to do it. And I think in human services and social services, we've talked about no wrong door for a lot of years, but what if there is no door at all for certain populations? So we have to get away from that. But I've been thinking, when you look at AI agents and the ability to stack AI agents into automate certain tasks and do things and make some decisions, that also gives you the flexibility to move to a multi-channel system that can be designed for different people with different needs and create that level of access. So my hope is that you take what you're doing now and you're building on that. And when you're done sort of building on that, you've created a system of systems that's actually going to allow people to get what they need, when they need it, where they need it, in the language and in the time that would be the case. So that is my hope for the future. I know in government, we're slow to adopt. That's why I'm really interested to see what's going to go on in this space, because I think it's the CBOs and the grassroots organizations and the relationships you have with the business side and private partners that's going to drive this, because you have a chance to affect policy. We, the government, God bless us all, like, we just didn't move until something happened and we were forced to move. We were very happy just kind of going along, and we've never been known for innovation, which is why I don't work there anymore, because it drove me crazy. No one would let me build all the fun things I wanted to build. But I think that that's the answer. Is I think AI agents in the next 5 years are really going to change the way things are done. And I wish I had them when I was doing social work, so it was doing the mundane tasks of gathering things and looking at records and reading things, and just give me the data and the information so I can make a decision, because that's what you wanted me to do, was interact with the person, make a decision, and then connect them to what they needed. But I spent a lot of time reading paper and doing emails, and that I didn't have time to call my clients. And Theo and I joked about this. I used to take calls from elderly clients who didn't need anything, but I was afraid, and I knew I might be the only person they talked to that day. And they called me because they knew I would pick up an answer. And I especially had that after I had a couple of them. I was maybe the last person they saw, I don't know. I interviewed them, and then they went home that night and they passed away. And I wanted to make sure if I was the last human that they saw, that they walked away feeling cared for. So.
And Theo, in 20 seconds, because we're going to be kicked off the stage here.
I'll do a 10-second for you.
Okay.
I want AI to be able to bring our financial services information and healthcare information together, because me as a person, I need both so that I can get to the outcome that I want.
Great. So I think what we heard today is that AI is not a silver bullet, but but has a ton of potential to be able to truly affect social care and make it sustainable. John, Theo, Pete, thank you so much for this. And thank you everyone for your work that you do in the community. And we certainly salute all the stuff that you are working. And thank you again for being here.
Thank you.